Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in today's session, we are going to discuss about a very small yet a very important topic, which is the role of a nurse in providing a safe and a clean environment. As we all know that it is very important that when a client especially comes to the hospital setting, the environment in which he is in must be safe and clean. And since the nurse is the personnel who is responsible for providing care for the client in the hospital, she is the one who will be providing the curative services to the client, and side by side she will also be the one who will be providing the preventive services in order to avoid them from further complications. So here not only the medications, not only the treatment, but also the environment plays a very important role in order to promote the health of an individual. Therefore, it is a duty of a nurse to provide a clean and a safe environment for the client in order to help them promote their health as soon as possible. So now we are going to discuss about few of the ways in which the nurse will be able to provide this therapeutic environment for the client. The first one is the unit cleaning. So here it's very important that the unit in which the client will be staying in must be very clean. For that, it is very important that carbolization must be done, and also for performing this carbolization we can use the Dettol or the Lysol solution. And here not only the unit but all the things, each and every equipment which will be coming in contact with the client, such as the bed, locker, cardiac table, IV stand, and any other equipments which we will be using for the client must be carbolized properly. We must also make sure that the physical setup of the unit must be proper. It must not look clumsy or must not be overcrowded. However, we should make sure that there must be a sufficient space between the bed in order to prevent any injury which can cause because of overcrowding. There must be presence of one chair or one table with the bed, and any extra things must be removed from the unit. And the next one is the noise-free environment. So here it is also very important that the environment must be noise-free. In order to reduce the noise in the ward, what we can do is that we can restrict the entry of more relatives into the ward at once. Why? Because in this manner, the noise produced will also be reduced, as well as the chances of cross-infection will also be reduced. So it is very important that relatives can be allowed to visit the client according to the policies of the hospital, because each and every hospital will have its own policy. So as a nurse, it is very important that whatever we do, we should follow the policy of that particular hospital which we are working in. The next one is the aseptic technique. So we should always maintain this aseptic technique, especially if there is presence of an infected client in the ward. Then it is the responsibility of that nurse to keep that particular client in an isolated ward and also treat them using the aseptic technique. And after these client has been discharged, then you must ask the room to be cleaned with an antiseptic solution. And the last one is the fumigation. So here it is the duty of the nurse that after some specific time period, fumigation must be done in each and every unit, because by fumigating the unit, it will also help to remove any infections or any microorganism which is present in that environment. And also, while they are fumigating the unit, it is very important that you must also supervise them so that you will be able to make sure that a proper fumigation has been performed. You must also make sure that all the things must be kept in place, and also if you find that there is any item which can be harmful for the client, then this must be removed, as well as you should make sure that the room in which the client will be in must be proper ventilated. And it is also very important that you must maintain an optimal temperature for that particular room. The temperature must not be too high or too low, because if the temperature is too low, then it can lead one to suffer from frostbite, whereas if the temperature is too high, then one can also feel very, very uncomfortable, and it can lead them to suffer from hypothermia or even from conditions such as heat stroke. So here, being a nurse, it is not just important that we provide treatment for the client, but it is also very important that we ensure that the client is safe, as well as we maintain a clean environment for them, so that they will be able to feel comfortable, they'll be able to feel safe, they'll be able to be at ease, as well as they will feel satisfied. So now we have come to the end of this topic. So in this session, we have discussed about a very small topic, which is the role of a nurse in providing a safe and clean environment. And while discussing this, we've also come to know that it is very important that we must provide a clean environment for the client to live in. We must provide a good physical setup of the unit, as well as we must provide a noise-free environment, and also we must follow the aseptic technique, and also fumigation must always be done. So I hope you guys have got a clear insight of this topic. I'll be meeting you guys in another session. Until then, have a good day. Thank you.